These are the 5 worst tips you're being told for spinal stenosis. And the scary part is, some of them sound so reasonable that most people never question them. Yet many people are following this advice and still not getting the relief they're hoping for. In this video, I'll show you the 5 worst pieces of advice people with spinal stenosis are repeatedly told, explain why they backfire, and help you understand what may actually be keeping your symptoms stuck. And make sure you stay until the end, because the final one may completely change the way you think about treatment options for lumbar spinal stenosis. Hi, I'm Dr. Kevin Wafer, a chiropractor in Houston, Texas. Living with spinal stenosis can be frustrating because the symptoms often affect much more than your back. Many people deal with stiffness, leg pain, numbness, fatigue while walking, and that heavy leg feeling that makes even simple activities feel difficult. You may start a walk feeling okay, only to find your legs becoming weak, tired, or unreliable just a few minutes later. One of the biggest frustrations I hear from patients is that they're trying to do all of the right things, yet they still are not getting the relief they're hoping for. You watch YouTube videos, you search online, you talk to therapists and healthcare providers. Everyone seems to have advice, but much of it can be conflicting and confusing. The challenge is that spinal stenosis involves a narrowing of the spinal canal, which can place pressure on the nerves. Because of that, advice that helps one type of back problem may not be appropriate for stenosis. Have you ever wondered whether something you are doing might actually be making your symptoms worse? That's exactly why this video is important. I'm going to walk you through 5 of the worst pieces of advice people with spinal stenosis are commonly told. And make sure you watch until the end, because it only takes one of these mistakes to keep your symptoms stuck. Worst tip number 1 is pushing through pain and keeping walking. This is one of the most common pieces of advice people with lumbar stenosis receive. The thinking sounds reasonable. If walking is good for you, then walking further should help you build strength and endurance. The problem is that many people with spinal stenosis notice the exact opposite happening. They start a walk feeling fairly comfortable, then the symptoms begin to build. Their legs start feeling heavy. The numbness creeps in. Their calves tighten up. What started as a simple walk suddenly feels like a struggle just to make it back to the car. Some people describe it as walking through wet cement. Others say their legs feel like they're slowly running out of power. Have you ever experienced that before? When that happens, many people keep pushing because they think they need to fight through it. They assume stopping means they're losing ground. But leg pain, numbness, weakness, and fatigue are not always signals to keep going. In many cases, they're the signs that the nerves are becoming more irritated as the walk continues. One thing that surprises many stenosis patients is that longer walks are not always better walks. Instead of trying to see how far you can go before your symptoms become unbearable, focus on consistency. Shorter walks with planned rest periods are often more manageable than one long walk that leaves you struggling for the rest of the day. The goal is to stay active without constantly provoking your symptoms. And that leads us to the next worst tip, because many people who are trying to stay active are also doing a specific stretch they believe is helping their back, when in reality, it may be making their spinal stenosis symptoms worse. Worst tip number 2 is doing back extensions like Cobra Pose to open up your spine. This advice is everywhere online. Someone develops back pain, searches for relief, and immediately finds videos recommending press-ups, back bends, and Cobra stretches. The problem is that with lumbar stenosis is not the same thing as a disc injury. Many of these exercises became popular because there are certain people with disc-related back pain. Unfortunately, people often assume that what works for one back condition should also work for all of them. If you have spinal stenosis, the spinal canal has already narrowed. When you repeatedly arch backward, you can further decrease the available space around the nerves that are already irritated. The good news is that this does not mean the movement is bad. In many cases, people with spinal stenosis feel more comfortable in positions that involve a slight forward bend. This is one reason many patients can walk further while leaning on a shopping cart than they can while standing completely upright. I have many videos on my channel that show forward bending exercises that are more suitable for lumbar spinal stenosis. I'll place links to these videos in the description below. The goal is not to force your spine into positions that aggravate your symptoms. The goal is to find movements that allow you to stay active while keeping nerve irritation under control. And speaking of walking, there's another recommendation that sounds healthy on the surface, but often leaves people wondering why their legs feel worse instead of better. Worst tip number 3 is stand up perfectly straight and walk tall. This advice sounds harmless. In fact, many people believe improving their posture is one of the best things that they can do for the back. The problem is that this mistake is very similar to the one we just talked about with Cobra stretches and back extensions. Both involve placing the lower back into extension, which means increasing the arch in the lumbar spine. If you have lumbar stenosis, that can be a problem. The spinal canal is already narrowed. When you force yourself into a perfectly upright posture and exaggerate that arch, you may further decrease the available space around already irritated nerves. Many people with spinal stenosis notice that standing in one place is surprisingly difficult. They can be relatively comfortable sitting down, but within a few minutes of standing, the heaviness begins. The leg pain starts creeping in. The numbness becomes more noticeable. Walking starts to feel harder than it should. Have you ever found yourself constantly shifting your weight, looking for somewhere to sit, or avoiding situations where you know you'll be standing for long periods? For many people, that is not a conditioning problem. It's a position problem. This does not mean posture is unimportant. It means forcing yourself into a rigid, perfectly upright position is not always the answer. Instead, focus on finding positions that allow you to move comfortably and stay active without continually aggravating your symptoms. Many people feel better when they stop chasing perfect posture and start paying attention to how their body responds to different positions throughout the day. And that leads us to the next worst tip, because many people spend 6 to 8 hours every night in a position they believe is helping their back, when it may actually be contributing to their morning pain, stiffness, leg cramps, and numbness. Worst tip number 4 is to sleep flat on your back on a rock-hard mattress. This advice has been around for years. Many people are told that a firm mattress and perfectly sleeping straight posture are the keys to a healthy spine. The problem is that lumbar stenosis often responds differently. Think about how many hours you spend in bed every night. If a position aggravates your symptoms, you're not exposed to it for a few minutes. You're exposed to it for 6, 7, or 8 hours at a time. For many people with spinal stenosis, lying completely flat can increase the arch in the lower back, just like we discussed with Cobra stretches and standing perfectly upright. This can place the lumbar spine into a more extended position. When the lower back remains in that extended position for hours at a time, some people wake up with increased stiffness, leg pain, numbness, cramping, or a feeling that their legs are not working the way they should. Have you ever gone to bed feeling relatively comfortable, only to wake up in the middle of the night or first thing in the morning with worse symptoms? I hear that complaint frequently from people dealing with lumbar spinal stenosis. A more comfortable option for many people is to create a slight flexion position while sleeping. If you sleep on your back, place 2 or 3 pillows underneath your knees, can raise your legs above the lever of the pelvis. This helps flatten the lumbar spine and can simulate the same gentle flexion position that many people find relieving during the day. If you prefer sleeping on your side, placing a pillow between your knees may also help reducing stress on the lower back and improve comfort. The goal is not to force your body into a perfectly straight position all night long. The goal is to find a sleeping position that allows your spine and nerves to remain as comfortable as possible while you rest. And that leads us to the final worst tip, because many people with spinal stenosis are told to completely avoid a treatment option that in the right situation may actually help them move and function better. Worst tip number 5 is don't go to the chiropractor. Many people with lumbar spinal stenosis have been told that the chiropractic care is completely off limits. They're told nothing can be done except medication, injections, or surgery. In my opinion, and in my experience, that is simply not true. I have many patients in my clinic with lumbar spinal stenosis who received chiropractic care and noticed significant improvements in their pain, mobility, walking tolerance, and ability to stay active. Before we provide any treatment, we perform a thorough consultation and examination. We also take spinal x-rays when appropriate. This helps us understand exactly what is happening in the spine and what types of treatment are suitable for that individual patient. When treating lumbar spinal stenosis, our goal is not aggressive twisting or forceful manipulation of the lower back. In fact, those are often the techniques people worry about when they hear the word chiropractor. Instead, we use gentle chiropractic corrective techniques that are specifically selected for the patient's condition. This may include gentle drop table adjustments to the sacrum and lumbar spine that avoid excessive twisting while helping improve spinal function and mobility. In addition, many of our patients receive non-surgical spinal decompression in a flexion-based position. By placing the spine in a more comfortable position, decompression may help reduce pressure on irritated structures and provide relief for people struggling with leg pain, numbness, heaviness, and difficulty walking. So, regardless of what you may have heard, a diagnosis of lumbar spinal stenosis does not automatically mean chiropractic care is off limits. When the condition is properly evaluated and appropriate techniques are used, chiropractic care can be a safe and effective conservative treatment option for many people with spinal stenosis. I hope this video helped you spot some of the worst tips people are for lumbar spinal stenosis, so you can avoid mistakes that you may be making your pain, numbness, heaviness, and walking difficulties worse. More importantly, I hope it helped you feel more confident about which recommendations are worth following and which ones may be holding you back. If you got value from this video, please like it and share it with someone who may be struggling with spinal stenosis and looking for answers. Drop a comment below and let me know which piece of advice you've been told in the past and whether it helped or made your symptoms worse. And if you want more simple exercises and practical tips to help you move better, feel better, and stay active, make sure to subscribe. I post a new video every week. Now, if you want to learn some of the flexion-based exercises that are more suitable for people with lumbar spinal stenosis, click on the video right here. I'll walk you through several movements that may help you stay mobile and comfortable without aggravating your symptoms. Go watch this video next.